Assalamu alaikum. I hope so you are all doing fine. I am Dr. Muhammad Ali Rabbani and today we are going to discuss the osteology of scapula. Okay, scapula is a flat bone that is present on the posterolateral aspect of your rib cage. This bone is also called shoulder blade and it articulates with the clavicle and humerus bone. This bone has through surfaces, ventral, dorsal, three borders, superior, medial and lateral, three angles, lateral, superior and inferior. We will go and discuss them again shortly. Side determination. Like any other bone, always ask three questions: how do I differentiate between superior and inferior aspect, anterior and posterior, and medial and lateral aspect? Let us move on to the model and try to figure this out. So, this is a bone currently in anatomical position, but let's make it at random. First thing you want to do is arrange in such a way that the inferior angle comes down in this part. The inferior angle comes down and the superior surface comes up. So this becomes the superior aspect and this becomes the inferior aspect. Now for the dorsal and ventral, the surface that is facing you, that is concave in nature. So this surface facing you is the ventral or anterior surface, and if we turn the bone around, this part with a spinous process shown and it is convex outwards, you can see it here. This is the posterior or dorsal aspect. Anterior, posterior aspects. Now the question is regarding the lateral. You see on this side, this is the glenoid cavity articulating with humerus. This is on the lateral aspect. Moreover, this border here, this is thick and the lateral border is thick. And on this part, this is the medial border with a thin border. So that makes this the lateral aspect and this the medial aspect. Using these pieces of information, you can get the scapula in anatomical position with superior aspect superiorly, inferior, anterior, posterior, and medial and lateral. So if you get the bone in anatomical position, you will figure this out. This is the bone of the right side. You can repeat this process for the left-sided bone too. So this was about the side determination of the scapula bone. Let's talk about the bony features, starting with the surfaces. There are two surfaces, ventral and the dorsal surface. The ventral surface is concave. You can see it's a little empty on this side. It is concave, and in the anatomical position, it is okay. This is concave, and as you can see, it is directed a little medially and anteriorly. So here is the and the on the back side there is the dorsal surface with the spine of scapula. Let's focus on the ventral surface. It is concave, and the thing that I would like to focus on a little more is these ridges. These are ridges that are due to the pull from the subscapularis muscle, and the one that is a thicker one on the lateral border. These are the ridges due to the pull of the muscles, and this lateral one especially helping to move the scapula through the pull of serratus anterior muscle. When we look at the dorsal aspect, you can see dorsal aspect is convex and it is divided into parts by the spine of scapula. These parts are called supraspinous fossa, the part that is above the spine of scapula, and infraspinous fossa, the part that is below the spine of scapula. These two fossae are connected to one another, are joined with one another through this pathway, through this notch called the spinoglenoid notch, because it is present between the spine of scapula and the glenoid fossa of the scapula. There are structures that are passing through them. We will see them too. This brings us to the discussion of borders and angles. There are three borders and three angles. Let me make them prominent. So here they are on the top. So this one, this is the superior border. This one on the medial aspect, superior border is having a dip downwards, having a notch. This is called suprascapular notch or simply scapular notch. On the medial aspect, this hole running along the whole length, this is the medial border. It is thin and sharp, not sharp by cutting the hand, but it is thin. So this is the medial border. And on the lateral aspect, this comparatively thicker part, this one, this is the lateral border. So we have three borders: superior, medial and lateral, and between them there are angles. Between superior border here and medial border here, there is the superior angle. Between the medial border and the inferior border, here is the inferior angle. It is comparatively thick because it is giving attachment to a number of muscles. And between the superior border, including the suprascapular notch, and the lateral border here, this is the lateral angle. Lateral angle is not as well defined as the superior and inferior one, and it is basically this glenoid cavity that is counted as glenoid fossa, that is counted as the lateral angle. Going on the posterior aspect, we will show the muscles that are covering these angles. If you look from the back, the superior border, that the superior angle, this is hidden by the trapezius muscle, and the inferior angle, this is hidden by the latissimus dorsi muscle. Now let us talk about the three processes that are remaining. Let me make this more prominent. This is the coracoid process. Literal meaning is crow's beak because it looks like that. This part is the spine of this whole shelf-like part seen from here and from here. This whole shelf-like part is the spine of scapula. It has two surfaces and three borders. The one free border on the posterior aspect, this one attached border, and again on the free border. And the posterior border, it's thickened here, and this part is called crest of spine of scapula, and this has superior and inferior lips that gives attachment to the muscles. And last but not the least, this part extending laterally from the spine of scapula is the acromion process, and it is giving attachment to the clavicle on from this part. This is the clavicular facet. So to summarize, we had two surfaces: the ventral concave surface with ridges or costal surface, the dorsal convex surface with spine of scapula dividing it into supraspinous and infraspinous fossae. We had three borders. This one was medial border, the lateral border, the thick one, and the superior border with suprascapular notch on this part. This is the suprascapular notch, and there is superior angle, inferior angle, and lateral angle thickened as glenoid cavity. And we had three processes. This crow beak like, this is the coracoid process. This whole shelf like spinous process, and this lateral extension of spinous process, this is the acromion process. Acromion process is flat from above downwards, and it is articulating with the clavicle through this facet. Now let us start discussion of the attachments of the scapula. For that we will change the color coding of the bone. This fossa, this gives attachment to the subscapularis muscle, and the subscapularis muscle gets attached to the humerus bone. Posterior aspect, if we go back on the supraspinous fossa, here is the muscle of the same name. This is the supraspinatus muscle getting attached to the humerus bone again. If we look down on the infraspinous fossa, here is the muscle infraspinatus muscle. This is getting attached to the humerus, back of the humerus. Okay, now let us move on to this muscles that is attached to the medial border on the anterior surface. This whole attachment, this muscle is attached to the whole of the medial border on the ventral aspect. This is the serratus anterior muscle. This is the serratus anterior muscle that envelops the rib cage and gets attached to the first 8 ribs. You can see due to attachment of the 8 ribs, it has 8 slips, and most of the slips first is from the upper part, next 2 or 3 are from the medial border, most of these are from the inferior aspect. Now comes the muscles that are attached to the coracoid process. There are 2 muscles that are attached to the tip of the coracoid process. On the lateral aspect, here it is attached the short head of biceps brachii. The muscle that you will see is going to move your elbow. Then on the medial aspect, this gives attachment to the muscle coracobrachialis muscle that again go and attach to the humerus bone. Then on the superior and medial surface on the border of this is the attachment site or insertion site, to say better, for the pectoralis minor muscle that is going to be attached to the rib number 2, 3 and 4. So these are the muscles that are attached to the coracoid process, and on the superior border there is one muscle that is attached, this one. This muscle is called the omohyoid muscle. You won't be discussing this much in the upper lip. It will be better discussed as you go on to discuss the neck. This is starting from the hyoid bone all the way down to the superior border of scapula. Okay, we are done with all the muscle that we can see from the ventral aspect. We have done subscapular muscle, serratus anterior muscle here, and then there is supraspinatus muscle, this omohyoid muscle, pec minor muscle, short head of bicep, and coracobrachialis muscle. Let's go to the back aspect. We had discussed the supraspinatus and infraspinatus. Let us do the 3 muscles that are attached to the posterior aspect of the medial border. These include from above downward, from superior angle to the spine of scapula. This is the levator scapulae. This is the muscle starting from the neck all the way down to the scapula. It elevates the scapula. Then comes this. At the base of the spine of scapula, this is the rhomboidus minor muscle. Rhomboidus minor muscle, it is starting from the last 2 cervical or last cervical and first thoracic vertebra. C7 and T1, some books say C6 and, but we don't have to go to the rhomboidus muscle detail. And here is the rhomboidus major muscle. It starts from the base of the spine of scapula all the way to the inferior angle, and this is attached from the thoracic vertebra below the attachment of the rhomboidus minor muscles. So these are rhomboidus major and rhomboidus minor muscles. Okay, now the muscles that are attached to the dorsal aspect of the lateral border. So these include 2 major muscles, all 3 are major muscles technically. The one near the inferior border, this is the teres major muscle that will get attached to the humerus. We will see as we go on with the next lectures. And then above it, the smaller one, this is the teres minor. Not shown in this picture very clearly, but it is interrupted due to the artery, subscapular artery that is passing through it. Last but not the least, this one. This is the part that is inferior to the glenoid cavity. This is infraglenoid tubercle, and this gives attachment to the long head of triceps muscle. The muscles on the back. This is the long head that is attached to the scapula infraglenoid tubercle. Now we have the muscle that is attached to the supraglenoid tubercle. This part. This is the muscle that is this one. This muscle is the long head of biceps. We did this is the long head of biceps, and we did the muscle short head of biceps from the coracoid process, and this is the long head of biceps. Now the two muscles that are attached to the spine of scapula. These two muscles you have done with the clavicle too. The one that is attached to the superior lip of spine of scapula and the supromedial aspect of the acromion process. This is the trapezius muscle attached to the back all the way from head to thoracic vertebra. This is the trapezius muscle, and then the muscle that is on the inferior lip and on the outer surface, this one and this one on the outer surface of acromion and inferior lip of spine of scapula, crest of spine of scapula. This is the deltoid muscle that makes up most of the curvature of the shoulder joint. So with this, I think you have done all the muscles that are attached to the scapula. Now we will move on to the ligaments that are getting attached to the scapula. Let us talk about the different ligaments that are attached. So here, traversing the suprascapular notch is the ligament by the same name. That is the transverse ligament or suprascapular ligament that is covering it. Then there is a ligament that runs between the coracoid process and acromion process. This is the coracoacromial ligament, a ligament that is running on the superior aspect of coracoid, running between coracoid process and clavicle. This is the coracoclavicular ligament with its conoid part and trapezoid parts. And then from the base of the coracoid process, there is a ligament that goes all the way from base to the humerus. This is coraco coracohumeral ligament, and then there is a capsule of the shoulder joint that is attached to the margins of the glenoid cavity. And last but not the least, if we remove the ligaments, these are glenohumeral ligaments, and this is the synovial membrane. If we remove all of these, this is a thickened portion that deepens the glenoid cavity. This is the glenoid labrum. With this, I think you have discussed now all the bony features of the scapula. You can revise them on the pictures of the natter from the ventral aspect, all the bone muscles that are attached on the ventral aspect, and the bony features of scapula from the dorsal aspect, along with the bony attachments. These pictures can help you revise that. And then we discussed the different ligaments that are attached to the different aspects of scapula. Thank you so much. With that, I will conclude the lecture. I hope so it has been helpful for you. If you have any questions regarding this topic, suggestions or feedback, please mention to in the comments and keep following us for the upcoming videos. The next video will be humerus. Thank you so much for following. See you in the next time. Till then, Allah Hafiz.